I love it when I go to conferences. I always come back with so many ideas from other professionals. So given with this conference, and I had a lot of time to think, a lot of time to explore, and I remember I used to do the Bates method when I was in high school and even in college, and I would definitely get these flashes of visual clarity. I had no idea what would happen. I had no idea how to make them come about. They would just happen at random. I think Bates was onto something, but when he died, I think the science died with him. I think he was on the verge of something from a scientific level. He did studies. Bates method people don't tend to do studies. They tend to have principles that they go by. Not really banking the Bates method, but it wasn't just quite effective for me. Some things that I listened to at the conference and just kind of merge what I know about the Bates method and what I know about other methods in vision therapy. I had seemed to have figured out a way to contract my other muscles around my eyes. Not necessarily relax muscles, but contract a different set of muscles. Which muscle is it? It's actually the inferior oblique. And the reason why that's important is it's the antagonist to the superior oblique, which is one of the muscles that Dr. Bates himself postulated to be the problem. I did the Bates method. I would kind of get on a roll, and then all of a sudden I would have major sinus pain, sinus attack of an infection, a major congestion, major drainage, and that would go on for another few days, and then I'd be back to normal. I wouldn't have those flashes of clarity. And I begin to notice a pattern with this. Every time I would just put my mind to the Bates method and say, I'm just going to do it. It happened almost every single time. And it seems that when I've learned to contract the inferior oblique, I can feel a release right here and an improvement in my breathing today. That's just what I feel, and it makes sense. You know, the superior oblique pulls on the trochlea, which would cause this downward pressure on the movement, downward pressure on the sinuses with that movement. The inferior oblique would be the opposite. So, I'm not saying that it's for sure, because I really don't know. I just know how I feel. More evidence will definitely be needed to be gathered on this subject, but it makes sense. It's like it feels like how I felt when I had a good professional who did cranial sacral therapy on me. That's kind of how I'm feeling. And that would kind of make sense to me because I've always had a little bit of a head tilt, which is usually the action of an inferior compensation of poor action or function within the oblique muscles. So that's my update. I'm actually quite excited about it because it just helps my method be more predictable for myself.